Good morning. It's Dr. Jeffreys again. We'll be continuing our health talk. But today I'm going to be talking especially to the ladies. The topic of our discussion would be vaginal discharge. A lot of people worry about vaginal discharge, but I hope that by the time we finish this session today, you will be able to understand what sort of discharge to be worried about and which one is normal. Now, down below, we do have a lot of secretions normally. These secretions can be normal because our body needs it to clean us up and to moisturize us. Unfortunately, when we have an infection or something else that is more scary, the secretions change. And that is when a lot of people start to ask questions. I'll be talking first about the natural secretions and what is normal. And it's important that you study your body so that if there's anything that's abnormal, you can easily find out what it is and you can notice it and you can get help. Now, the vaginal secretions change at different times of the month. Immediately after your period. As your period finishes, if you leave it about 2-3 days, you have slightly clear discharge. Usually it doesn't smell bad at all. Once you're coming to about the middle of your period, your cycle, you will notice that the secretions from down below is usually very clear. It's a bit slimy. It is transparent and it doesn't smell bad at all. A few days after this, you will notice that the secretion is getting thicker. Thicker as in it can look like white color, which is different from the transparent one that you had around your ovulation. And it's usually still not offensive smelling at all. You would notice that it will get thicker and thicker up until the day before your period, when you will then start to notice the ones that you get to see before your period and then your period. This is the natural pattern. However, for other reasons, you can notice a change in the color, in the features, and in the smell of your discharge. If your discharge is bloody and it is not your period, you need to get it looked into, because this can either tell us that you're having an infection. If you're sexually active, it may tell us that the baby or the pregnancy is not going on very well. If you're within the reproductive age, it may mean that you're pregnant or you're having what we call spotting. If you are outside the reproductive age, it may mean that there is something happening within the womb that you need to pay attention to. If you're definitely outside the reproductive age and you've stopped having periods and you notice a bloody discharge, it is worth going to your doctor, because it may mean that there is something seriously wrong that you need to be having treatment for. Having said that, if you notice an offensive smelling discharge from down below, most of the time it's due to an infection. There will be other features that will help you to know. Some women may have itching down below. Some people may have pain during sex. Some women may have irregular menstrual period, which should be pointing towards the direction that you need to get checked. It is important that you study your body and you know what is normal for you. It's important that you actually check what sort of discharge you have. Most women just get up and go without actually studying their bodies. If you don't know what is normal, you will not be able to identify or recognize what is abnormal. Most people with offensive smelling vaginal discharge that is colored, most of them have got an infection. Infections are not things for us to joke with as women, most especially if you have a hope of getting pregnant in the future. They can potentially block your tubes, and most of them are treatable. So I'm going to leave you with this today. Even when you're well, check your body. Know what is normal for you. So if you see anything abnormal, you do need to talk to someone. I'll be back again tomorrow to talk to you about the different types of infections that women can have. Up until then, don't just whisk the knickers on. Check and have a look what's been dropping in them. Take care. See you tomorrow.